When it comes to what I do as far as helping patients hopefully achieve a reduction or complete resolution of pain, there's essentially four pillars to what they call PNE+. So that first pillar is pain neuroscience education. It's extremely important that you understand where your pain is coming from and the different factors with it. If you get down the wrong path, if you want to chase every image that comes up on your MRI as quote unquote not normal, then you're in for a losing battle. You have to understand the nervous system and its role in pain. The other thing is aerobic exercise. As I've talked about in a lot of videos, our nervous system is only about 2, maybe 3% of our mass of our entire body. Yet, it consumes about 25% of our oxygen. How do we get oxygen to things? Blood. So if we want to reduce our pain and take advantage of different things along that same mechanism of nourishing nerves, we need aerobic exercise because of its ability to deliver oxygen throughout the body. Sleep hygiene is our third. Now, sleep is something that really as a medical system, we only understand a small sliver of its effect on our body. We know it's important though because you can't live if you don't have sleep for an extended period of time. So there's all of these processes that happen, but not only do they require enough sleep, but they require restful sleep. So if that's something you're struggling with, you should really take a deep look at your sleep hygiene, which I've talked about in previous videos, and figure out how to improve that by any means necessary. And then goal setting. So this is something that's pretty consistent across the spectrum of the fitness and healthcare world. You can't have these generic goals and not take measurable steps toward them. They should be specific. You should know what you're trying to do so you can take steps to doing it. You should be able to measure them so you can see your progress and realize when you aren't making it. And they should be realistic. So if you're not exercising now and you want to start aerobic exercise because it's one of the other four pillars, don't start with an hour 3 times a week. Start with 5 minutes a day. That's simple. And in some of my previous videos, I've talked about how even just 1 to 2 minutes of exercise has great benefits on cardiovascular disease risk, all-cause mortality, cancer risk, all from simply 1 to 2 minutes of exercise. So again, our four pillars are going to be the pain neuroscience education, understanding your pain, aerobic exercise, sleep hygiene, and goal setting.